Hi, this is a very quick tutorial on how to use the clinical prioritisation forms on Evolve. Now, the forms have changed since we've started using it to reflect the various stages and the developments of the programme. So I'll just quickly run through what any changes might mean and when you should be using them for your patients. So I'm just using a test patient here. Now, the first addition that we've added to the form recently is the review phase. Now, what this means is if you're grading a patient as, for example, a P2, that patient, we need to treat them within a month. And if we go past that date, we need to then contact that patient and check that they're waiting well while they're on the waiting list. So check if they still want to go ahead with their surgery, to check if they need any support or information. And when we do that, that would be review phase 2, 3, 4, and so on. So if you are adding a patient directly to the waiting list, so for example, this patient, say, has been seen yesterday in clinic and the consultant would like to add them to the waiting list, that would be review phase 1. And this is your first time you're adding them to the clinical prioritisation form for this particular procedure. So fill out your specialty. So let's just say we'll go for that one. The pool is automatically filled in for you. So in this case, it's surgery and anaesthetics. And we'll just choose a consultant. Let's go for, let's go for, okay, so your pathway ID is going to be available on your PTL. And it's usually available under column AT, and it's this very long number here. Please don't use hospital numbers or anything else. It's the pathway ID is absolutely key to this form then pulling through to our PTL. So we'll pop in here a procedure. You can again copy and paste that from your PTL. The clinical priority is what your consultant has listed the patient as. So, for example, you've got a 2-week wait, urgent. We very rarely use them 52 weeks or routine. So I would say that the main ones that we use here are 2-week waits, urgents, and routines. We're going to go for routine for this one. Now, another change that we've added here is the P coding decision date. So this date is going to be when the consultant originally graded that patient at that P code. So let's use today's date because we're adding in review phase 1. It's the first time we've added them. The consultant has only just graded them. And so we'll do that as today. Now, the current status, I would say that for review phase 1, the only one that you should be really choosing is added to access plan. If the patient, for example, has been treated elsewhere, then your consultant wouldn't be listing them at this stage. So that doesn't really fit the criteria. Again, if the patient's symptoms have resolved or treatment no longer required or surgery declined, the consultant wouldn't be listing the patient. So you wouldn't even be getting to this stage. And that also applies with the other options down here. So if you're doing review phase 1, then 99% of the time you would be saying added to access plan. I would also fill in that the patient was seen in the last 3 months. I think it pretty much goes without saying because you are listing the patient, they've recently been seen. So again, that is going to be applicable for most of these. If you know that the patient has specified where they would like to be treated, sometimes it is noted in the letters that perhaps they have mobility issues and they want to remain at one hospital, by all means fill those out. Okay, and then down here is your P coding that your clinician has given to this patient. So let's assume that this is a P4, it's a routine, and your consultant has selected P4. They haven't asked for any additional information, and so you can click none. and then you can click submit. And just note here that the form is telling you this process will end here. So this means this form will be uploaded into the correspondence of that patient, and the next day when the PTL reruns, the P code will pull through to the PTL and it will show as a final form. So I'm just going to go through another scenario. So let's say that this patient was perhaps a P2 and they have gone over their P2 time frame due to capacity. We haven't been able to book them a TCI date. So we would then need to contact that patient and check that they are waiting well while on our waiting list. So when we get to that stage, it would be review phase 2. And as you can see, a lot more options then appear here. Okay. We would need to make sure that the original P coding decision date is pulled through. So for example, let's say that this patient is a P2 and they were listed 6 weeks ago. So we would need to go back, check that original clinical priority form and pop on that original P coding decision date. So let's say that we originally filled this form out on the 14th. Now this must remain consistent every single time you fill out a form for this patient for this particular procedure. So this will carry on if you move to review phase 3, for example. You would then need to continue to pull through this original date. What it does is it indicates on the PTL when they were originally graded at this P code. So let's say that we've spoken to the patient to check that they're waiting well on our waiting list, and then we can choose one of these other options. Okay, so they're quite self-explanatory. Patient treated elsewhere, patient symptoms have resolved or treatment no longer required. The symptoms have not resolved, but surgery is declined, perhaps for other issues going on in their lives or other worries. What we would ask is that you could maybe put some narrative in any other information just to support that. I would avoid using patient wishes to proceed with treatment but does not require a clinical discussion, because that will then pop the form into your clinician's workflow for them to finish off, and there's not really anything for them to review at that stage. If the patient obviously would like to have a clinical discussion, please select that one. And then again, as I say, this form will be put into the workflow for the clinician to then review. Another key to review phases 2 and onwards is to check if the patient has needed to seek any medical advice from the GP or the hospital. So again, we're checking if they are waiting well, and if perhaps their overall wellness has declined. So for P2 patients only, it's if they've been seen by the GP or the hospital in the last month, and you would select that if they have. And again, put some supporting narrative here around why they've needed to seek that medical attention. That would then be evidence for your clinician to then grade them again if they needed to be made more urgent, for example. And if you are calling P3 and P4 patients, it's if they've been seen within the last 3 months. So you would select that. Again, put in your supporting narrative if the patient is comfortable with telling you what they sought that medical advice for, pop that in there. And again, this would feed through for your clinician to then review and see if they need to bump them up from a P3 or a P4. Perhaps they would look at that narrative and think, we need to make this a P2 or we need to make this more urgent. So any of these options will put this form into the clinician's workflow, and these will show on your PTL as initial. That means they've been started, but they need to be reviewed and finished off by a clinician. Make sure that you ask them if they require any information here, and if they don't, select none, or select which ones that they would like. So for this example, we will use those. When you click submit, if you have selected any of these, or that they would like a clinical discussion, or that they are undecided, For example, like I said, this form will show as initial on your PTL, and it will be sitting in the workflow for a clinician to finish off, regrade if needed, and then they will need to submit it. So then it appears in the correspondence. If the patient is in exactly the same position as they were when they were listed, they're continuing to wait, they don't require a clinical discussion, they're happy to go ahead with their procedure as decided a few weeks ago, then you can again select Added to Access Plan as you would have with Review Phase 1 and select the same P coding that they were already graded at. Because none of their situation has changed, then we can keep it as the original P coding. So let's say this one was P4. Again, if you select Added to Access Plan, the process will end there. Click Submit, and this form will then be final on your PTL. Okay. Hopefully that covers any queries and questions you have with the clinical prioritisation forms and the phases. If you have any questions, please don't hesitate to contact myself, Lisa Magor, or the validation team at any time.